name's Taylor Sullivan, and today I'm going to be talking to y'all about the causes of cigarette smoke. There are many health problems from smoking, and some that many people do not know. So I'm going to inform y'all on the health risk of smoking. Smoking has been found to harm nearly every bodily organ and organ system in the body and diminishes a person's overall health. Smoking is the leading cause of cancer and death from cancer. It can cause cancer in the lungs, the liver, the pancreas, the stomach, the cervix, the colon, and the rectum. Cigarette smoking and exposure to tobacco can cause about 480,000 premature deaths each year in the United States. Of these premature deaths, about 36% are from cancer, 39% are from heart disease and stroke, and 24% are from lung disease. Smoking is the leading cause of premature preventable death in this country. The next health risk you can encounter from smokers is secondhand smoke. Secondhand smoke has been classified as human carcinorol, known as cancer-causing agent, founded by the International Agency for Research on Cancer. Inhaling secondhand smoke causes lung cancer to non-smokers. Approximately 7,300 lung cancer deaths occur each year among non-smokers in the United States as exposure from secondhand smoke. Secondhand smoke causes disease and premature death in non-smoking adults and children. In the United States, exposure to secondhand smoke is thought to cause about 34,000 deaths from heart disease each year. Pregnant women exposed to secondhand smoke are at risk of having a baby with low birth weight. Children exposed to secondhand smoke are at an increased rate of ear infections, colds, pneumonia, and bronchitis. But for the smokers, there are benefits if you plan to quit smoking. When you quit smoking, your heart rate and blood pressure, which are very high when you're smoking, return normal. Within a few weeks of quitting cigarette smoking, you will have improved circulation and you do not cough and wheeze as often as you did whenever you were smoking. After several months of quitting, people can expect substantial improvements in the lung function. Within a few years of quitting, people will have lower risk of cancer, heart disease, and other chronic disease than if they had continued to smoke for the rest of their life. In addition, people who quit smoking will have an improved sense of smell and will be able to taste food better. Data from the United States National Health Interview Survey show that people who quit smoking, regardless of their age, are less likely to die from smoke, regardless related illnesses. Those who quit between ages 25 through 34 lived 10 years longer, and ages 35 through 44 lived about 9 years longer, and ages between 55 through 64 lived about 4 years longer. I am not a fan of cigarette smoke, nor do I agree that you need to be smoking, because I feel it harms you and it harms all the people around you. And growing up, my grandmother, she smoked, but I wasn't really sure of her smoking, and she would always go to the bathroom and smoke, and then later her health started decreasing. So she started having trouble breathing and was unable to get around. She went to the hospital because she could not breathe on her own, and she would not eat because her lungs were failing. And I sat with her in the hospital for 3 days just watching her suffer because she was unable to breathe and she just was in pain. And later she passed away. And I do not want to see anyone or any loved one die because of cigarette smoking.